Hi there, Karen Bisueta. In this training, we're going to talk about habituation from daily routines. The repetitive ways we do things day in, day out, through the years, right? The way we sleep, the way we play, the way we work, the way we move. And how does that affect our body? And ultimately, how does it affect our posture, right? Because the posture says a lot about core stability with the alignment of our bodies. So let's think about a neutral posture. That's the most effective way we want to be in a neutral spine, neutral alignment. So if you looked at a side view, we use a term called plumb line. And the line, think of a piece of string. You would take the string from the ear, down the center of the shoulder, through the hip, and through the ankle. So that line would be nice and straight in the center of the body. Now, that would be your neutral spine. But if you had maybe forward hips, notice that string wouldn't be straight. So notice what your posture, what your alignment is. Some common faulty postures are sway back, right? Sway back is one posture where hips are forward. So the hips are tilted forward. There's a shortening of the rectus abdominis here. And then the thorax, the rib cage, where the rib cage meets up here to the upper thoracic spine, is behind the pelvis. So think of this faulty posture that some of us may be in and what it does for our cervical spine, what it does for the low back, right? It puts a lot of compression there and you can't stabilize the core. Now, kyphosis, this is another one where the thorax is behind, right? And you have a posterior pelvic tilt and you're rounded through that upper body. So it's a real forward shoulder rounded position. Most of the times here you get a forward neck, and this causes tight traps, closes off the restriction of our breathing. Do we see that there? Low back sensitivity, pain, stiffness. All right, so we have to focus on ways for optimal posture to come to that neutral pelvis, engaging the deep core muscles, lifting up tall, shoulders back. But it's not as easy as standing up, right? Sometimes those faulty postures, it's muscle stiffness, muscle tightness. It's the way we've been doing things for years. So Pilates really helps us with small movements, take us out of those faulty postures, working from the inside out, right? That deep core, learning how to stabilize that deep core, and then learning how to work the levers of the body, right? The more superficial muscles, the bigger muscles once we have that core in place. Another common posture that is faulty is just an anterior pelvic tilt, right? So lordosis of the low back, where I'm really arched here. That's going to cause a lot of pain, right? So what if I have that really arched back and then I go to pick something up and it goes into more of an excessive arch? That's going to cause some compression back there. So think about your posture. Look at your side view, maybe take a picture and see, are your ribs back behind your pelvis, right? Is your head forward from working all day? And then what we can do to fix those faulty postures. In our next training, we're going to go through some actual exercises, but check out your posture, check out your spine. Your hip bones want to be level. That's your ASIS, right? I don't want one higher and one lower. And doing small movements with Pilates and pelvic floor can help get that straight. And little by little, your posture can improve. Your pain can improve, right? If you have pain or stiffness, the chest can open up, you get more breath in, and your body is working more optimally. So take a look at your postures, what you do on a daily basis, how you can counteract those actions. So if I'm at a computer all day and I'm here, can I get a standing desk, right? Or put the computer higher to take me out of those movement patterns that I've been in for so long. So go ahead, envision your workday. Look at maybe some faulty patterns that may be happening with your body and think about how you can correct them, whether it's for you or your clients. Thank you so much, and I will see you at the next training.